New COVID vaccines could be in local pharmacies as early as next week. Manufacturers say they have the doses ready to go and are now just waiting for that final FDA approval.
WRAL health reporter Grace Haba explains how the new dose could provide better protection this fall.
For the first time, updated COVID vaccines are expected to roll out at the same time as flu shots. Not only would this save you from making multiple trips to your local pharmacy, but it could also potentially provide more accurate protection.
Moderna execs say millions of doses of its updated COVID vaccine are ready.
We're anticipating the FDA determination of the updated COVID vaccine imminently, which would mean that the vaccine would be in the system within days thereafter.
Compared to annual flu shots that require guesswork and predictions months in advance that don't always pan out to be accurate, Moderna's VP of Medical Affairs in North America explains mRNA allows for COVID vaccines to be updated faster.
We were only given the information after the FDA deliberated and their advisors made the recommendation on what should be the formulation, what variant should be in this updated vaccine. It was a mere 6 weeks ago.
The result, doses you could get as soon as next week will provide better protection against what's out there right now.
We're very fortunate that the vaccine should be at the same time in the system. But moving forward, we want to get to a point where it's far more feasible, far more practical, far more pragmatic, and that's that combination influenza COVID vaccine.
The CDC recommends that everyone 6 months and older get an updated COVID and flu vaccine. For a closer look at how those recommendations could vary based on your age and which manufacturer is behind the vaccine you're getting, just look for this story under the Health tab on WRAL.com. In Wake County, Grace Haba, WRAL News.
Thank you to Grace. And the CDC says research shows getting your updated COVID vaccination can also reduce risk of developing long COVID in both children and adults.